Hi, everyone, and welcome back to the BRAINIAC podcast. I'm your host, Stefan and we've got a great episode for everyone today as we head into the holiday season. So in today's episode, we'll be talking about the role that chiropractors play in concussion care and rehabilitation. When we think about concussions, maybe chiropractors aren't the first healthcare professional that come to mind. However, they provide a tremendous amount of value and benefit. And so to help us understand the important role that chiropractors play and gain insight into value they can provide to patients with concussion, I'm really excited to be joined by Dr. Michael Hennes. Dr. Hennes is actually joining us from Minnesota today. He reached out to our chapter to see how he could help contribute, and we thought it would be a great idea to have him on an episode of BRAINIAC. So thank you so much, Dr. Hennes, for taking the time to join us today.
Yeah, thanks for having me. I'm really excited to be here.
Awesome. And just a quick bio so we can get to know Dr. Hennes a little bit better. He is a chiropractic physician and board-certified chiropractic neurologist. He holds a diplomate in neurology from the American Chiropractic Neurology Board. And additionally, Dr. Hennes is a member of several chiropractic associations in his region. I think what we'll do is we'll just start off with a little bit of an icebreaker. So beyond the bio, our listeners can get to know you a little bit better, Dr. Hennes. So I just want to ask, how did you sort of get involved in the concussion space, and tell us a little bit about your journey and what it was like to get where you are today?
Sure. So everyone's kind of familiar with the chiropractic paradigm. While I was in school, I was really looking for a deeper answer as to how an adjustment could have such a wide range of effects on so many different conditions, right? We always hear about the neck pain, the back pain, but why can your indigestion go away, or why can other seemingly unrelated things happen? And that led me to study neurology, more specifically functional neurology, and that's really how well the brain works, and then what can my physical inputs to the body, an adjustment, a stretch, anything, really change all of that stuff for the brain. And then in studying that, it kind of led me to the realization that I had past concussions. I knew I had the injuries, but never really had been diagnosed or put it together that maybe some of the stuff that I was still dealing with could be from this post-concussion syndrome. I didn't really know what that was. You hear in podcasts all the time, yours including your last couple episodes, someone always says concussions weren't a thing. Well, I was growing up and playing sports in that era, and that's exactly what it was. You got up, you walked it off, and when you had headaches 2 weeks later, it was like, I don't know what that could be. So that's kind of how I got into it. And a lot of it started with me studying concussions and saying, if the brain isn't working and it doesn't make sense, this is really the epitome of that condition. Is there's nothing on your scan, but you just don't feel good. And the concussion is really what spurred that on. And in doing so, like I said, I kind of found out about my own past injuries and, had some work to do on myself then.
For sure. Yeah, it seems to be like a pretty common theme is that people have had their own experiences with concussions. They weren't sure what was going on, and then it leads them kind of down a path where they're able to sort of help people who are used to who are in their position kind of years later. That's really interesting.
We still hear it from patients too. Is someone will bring their kid in. It's like, well, I don't know. When I was a kid, concussions weren't a big deal. It's like, we know better now.
Yeah, thankfully for sure. So, I just wanted to start with a bit of sort of a brief overview type of conversation before we get into sort of some more specifics later on. So just generally speaking, how would you describe the role that chiropractors play in concussion care?
Sure. So this is a little bit of a twofold answer here, but one of the things that commonly comes with concussions, or that, two of the more common symptoms, are going to be headaches and neck pain. And a lot of times those headaches are actually derived from that neck pain. And we know chiropractic does wonderful things for whiplash injuries, auto accidents, that sort of thing. And the mechanism of a concussion is oftentimes very similar, even if you never hit your head, right? You can still get that concussion from, say, a whiplash. Well, if we've strained those neck muscles, or they're not doing their thing, they're not giving your brain good information anymore. And that can cause a sensory mismatch. And that makes it very difficult for the brain to tell what's going on, leading to those symptoms. So one of the things chiropractors are fantastic at treating is neck pain. So just in that realm, we have something to offer the concussion community. Headaches, tension headaches, again, we have something fantastic to offer there. When you start to look into the chiropractic neurologist paradigm, we're really concerned with what kind of inputs we can give the body, and are those sensory systems integrating in the brain as well as they should. In the clinic, we like to use this analogy of three friends will go into a party and they should tell you the same story. Well, in your body, what are those three friends? It's your eyes, your inner ear, and those neck muscles. Well, if you've injured one of them or one of them isn't working as well, suddenly your stories don't match up. And that's where we start to get symptoms. It's really hard for your brain to put that together. And it does a really good job for a long time until it gets tired, or you have another injury and the inflammation slows you down, or one of those things, and that story starts to change. So kind of twofold. We have chiropractors looking at the neck and the headache, and then you have the neurology portion where we're looking at really putting all of those pieces together.
Okay, really, really interesting. And I love that story analogy. It's never something I've kind of heard or thought of before, but it really does make sense when you put it that way. And speaking of, the tension headaches or the neck muscles, are there specific symptom profiles that are more sort of geared towards chiropractic care or more commonly seen by chiropractors in comparison to maybe some other healthcare practitioners?
I find more people that say come to my website, they tend to already have the headache and the neck pain. That does tend to be a little bit more of it on like a cold search. Now, if someone's seen me already and they say, hey, my friend has this, is that something you would work with? Then we start to get into more of the vertigo or also headaches, but those headaches tend to be a little more described. Like the headache is behind my eyes. It's less of a tension headache. So it does tend to be more of the physical type of symptom. The muscle aches and pains, that sort of stuff that I tend to see a little bit more. But that's kind of gone by the wayside too. I kind of get it from all over the place, just from referral at this point. So,
okay.
So yeah.
Interesting. And then you made a distinction in your first answer between just sort of maybe a general practitioner chiropractor versus, well, you are a chiropractic neurologist. Is, do the general practitioners also see concussion patients? And if they do, what differs between your practice and what maybe a general practitioner might do?
Sure. So one of the associations I'm in is the Minnesota Chiropractic Association, our sports council. So the group of us that really focus on sports, we really have a good focus in the concussion world because we do a lot of like sideline care. And part of our job with that is to be able to identify and either pull a player off the field. But then the caveat is a lot of times that player will come in to see me personally because I'm the one that talked to them on site, or they'll see one of my colleagues that's in the same group. So, kind of like we were talking about, we're assessing to see, a whiplash injury is huge in a concussion. Again, if those muscles aren't giving us good information, we have to work on that. The tension headaches, the general just structural stuff that's going on in a person's neck or body or, any of that can really play an effect. So you're going to have things like rehabilitative exercises. You're going to have some adjustments, maybe some modalities like some ice or some heat or some stim to try and rehab those soft tissue injuries. And then in my world, functional neurology or chiropractic neurology, clinical neuroscience, it goes by a whole bunch of different names. So pick the one you like. I like functional neurology, and my job is to figure out why the brain isn't working at its optimum performance anymore, because you're up, you're getting around, you're moving, but maybe you're super fatigued or your energy levels are low, or you're getting dizzy because you don't know where you are in space anymore. And really what that comes down to is figuring out which of the three things neurons need broke down. They need activation. So are they not getting the sensation up to your brain? Are we not getting oxygen there, or are we not getting a fuel source like glucose or ketones? And so my practice is a little different in that I do a lot more things to try and promote brain health. So there's a lot of nutrition involved, a lot of supplementations involved. Some basic movement exercise just to increase the heart rate is very therapeutic for a concussion. We can also do things like stim or lasers, and adjustments are fantastic stimulation. What do? We take a joint, we move it, we stretch the muscles out, we compress different pieces of the joint. All of that is information into the brain. And by directing how we do an adjustment, maybe we do a lot of pre-stress or not a lot of pre-stress, or a low force technique or something like that, we can influence how that information heads to the brain and try and target more specifically which part of the brain we're working on.
Okay, very interesting. Thank you for that answer. So now I think what we'll do is we already kind of got into that space a little bit, but we'll fully sort of dive into the clinical and the treatment side. When I was reading through sort of your approach to care, one thing that really stood out to me was the sort of importance that you emphasize on that initial visit or consultation. So can you walk us through what that would look like? So for example, if I was to come to your clinic, I had a concussion maybe a couple of weeks ago and I'm really dealing with some symptoms. How do you go about getting that comprehensive evaluation of that new patient?
Sure. So, excuse me, a lot of times when someone comes in, especially if they don't know much about me, they see chiropractor behind my name and they think it's going to be an adjustment a couple of times and they're going to be feeling better. And that's kind of it. And sometimes that's the case. Sometimes it's not. But being able to look at all of the different things that are going to go into your brain having good information. So we have to look at all of the different symptoms. All the different systems that play into this. Mm-hmm. So I already talked a little bit about nutrition and supplementation. Well, your brain can be working perfectly, but if you don't have the good nutrition in your body to begin with, it's like trying to drive your car without any gas in the tank. It doesn't matter if you drive a Ferrari or a Pinto at that point. Yeah. You're not going anywhere without gas in the tank, and the brain's the exact same way. We know concussion is an inflammatory thing, so it can really mess with that metabolism. And then we have kind of an energy crisis in the acute phases, especially. So those are things that we have to address. And the sooner you address that, the sooner you can get people healing. And that's where some of that low sub-symptom threshold aerobic exercise can be very helpful in just keeping that fuel supply up early on. So nutrition is a huge piece that I find is missed a lot. And I think a lot of it just comes down to pharmacy isn't terribly useful. So in the medical paradigm of thing, I'm not ripping on them. They're really good at saving a life, but there are some things that, well, obviously I think I do better. Otherwise I wouldn't do it. That's one of them. And then we have to go through all the different systems, right? You have to look at the vestibular system. You have to look at the visual system. You have to look at the structural component of stuff. You have to look at range of motion, strength, and all of those things. And one of the things I see a lot in patients that have been other places is they've done all of this. The problem is they didn't do it all at once. So they'll work on one thing for a while and then it didn't work or they got a little better. So they'll move on to the next thing and it kind of works, but they never really connected those pieces together. And that's really what I try and do is connect all of the pieces together so that they're doing the right thing at the right time for the right intensity and not skipping a step.
Okay. That's really interesting. And that point of, maybe other practitioners don't do everything all at once kind of takes me to my next question, wherein does the approach to treatment differ or vary based on the symptoms that a patient's experiencing, or is it sort of kind of work on everything at the same time, regardless of what someone's feeling at that moment?
Tough question. A little bit of both, honestly. You kind of have to look at the whole picture all the time, but at the same time, you have to figure out what the biggest problem is and focus on that. Because your body, we're not designed to be healthy all the time. Okay, we're designed to heal. We're very, very good at it. The problem is we're also very good at compensating. So we have to do first is get our bodies out of this crisis state, out of the inflammatory state, out of the anxiety, out of the panic, so that it can quit trying to compensate for anything so that we can start to unravel those different pieces. So I'm always trying to get that 35,000 foot view, but also look at this patient's coming in and they're dizzy or they have vertigo, they don't know where they are in space. We need to spend most of our time there. Whereas this person over here, they've just got a lot of neck pain and they've got a severe whiplash injury. And we just have to work on that neck pain and get that neck rehabilitated first. And then we can start to work on some of the other things. But you always kind of have to have in the back of your mind, what could be causing this to break down as well. So you have to look at all of it at once.
Okay. So if there's a major problem, you deal with that, but not forgetting about all the other components that can play a role in recovery and just function in general then.
Exactly.
Okay. Perfect. And I want to focus in sort of now on one type of, I guess, therapy in particular. And I've actually come across a few papers that have highlighted that manual therapy can be, quite beneficial for those who are experiencing persistent concussion symptoms. Can you briefly describe to us sort of what manual therapy is first, and then sort of explain why it might be very helpful for patients who are experiencing persistent symptoms or just symptoms in general for that matter?
Sure. So manual therapy is a really broad
Mhm.
modality. And whenever I say it out loud, I always think of the insurance coding part and what kind of gets thrown under there. But manual therapy is really, in my opinion, anything that involves an instrument or just hands on the patient, right?
Okay.
So this could be things like massage, it could be body work, it could be like a fascial stripping, it could be the chiropractic adjustment, it could be like a instrument assisted, like the brand name one is Graston, right? Any of those things kind of go into manual therapies. And I had mentioned this before, but I'll go into it a little bit more. If you look at the physical therapist or the physiotherapist, depending on where you are, the chiropractor, the massage therapist, really what we are receptor-based therapists.
Okay.
Okay. So your brain is like a big computer and it's got wires shooting out all over your body, the nerves, and they connect to different receptors. You sense things like hot, cold, joint movement. Are your muscles contracting? Where are they in space? Vibration, that sort of stuff. And all of that information goes into the brain and the brain processes that. If your muscle's too tight, it's because the brain thinks that that's a normal resting state, or something's
Mhm.
unstable and it's trying to stabilize for it, or it's not getting good information from the muscle group next door. Okay.
Okay.
And so through manual therapy means, again, all of the stuff I listed, we could try and change the length of that muscle or stimulate those receptors to try and get that brain to essentially relearn where normal is. Okay, so
Okay.
if we do something like an adjustment, that's one set of receptors that we're stimulating. If I do trigger point therapy, completely different set of receptors. Okay, if I have you move while we're doing that, same thing, different set of receptors. So by playing on the information that your brain is getting, we can stimulate different parts and try and, I guess, normalize the communication between the different parts of the brain.
Okay. And
Does that
and
make
it
sense?
it does make sense. After you kind of explained it, it does make a lot of sense. And specifically for patients with concussion who are dealing with persistent symptoms, could that just be that they have that hasn't been tackled yet, and so weeks later they're still feeling the same way because that approach hasn't been taken? Is that why it could be so effective for these types of people?
I think so, especially if you have kind of the old mentality, the old cocooning mentality where people just aren't doing much, especially if they have any pain and they're starting to get into guarding behaviors and stuff starts to, we talk about the neck a lot, but it's a concussion. So a lot of it
Hmm.
comes from the neck. And if they're not moving that, it'll start to stiffen up. It'll try and compensate. Your brain just tries to protect the neck and avoid pain. And then you start to get into some of these ranges of motion that you're not familiar with. And to your brain, you've become unstable if you haven't even started to lose some of the protein component of the muscles just from breaking down from not being used again. So I think that's a huge part of it. The other part is we know your brain is bathed in CSF, right? It's got this fluid all around it
Hmm.
that supplies it nutrients and all of this stuff. That fluid it flows on its own, but in order to really get it moving, you have to have movement of those upper cervical segments.
Okay.
So if you're not moving your neck and no one's moving it for you and you're avoiding moving those things, you're going to start to get some stagnation of that. And that can be very irritating in itself. So that makes it very, very difficult to rehab that without going in and doing something physically about it. Some people are very
Okay.
good at doing it on their own, but sometimes there's stuff you just can't do.
For sure. And so, based on what you just said, I think I know the answer to this question, but I'm going to ask it anyway. Do you think that manual therapy is something that should be implemented into what's regarded as a normal concussion protocol, like return to sport protocol? As said, a lot of times it might be overlooked. So, do you think that's something that should be implemented pretty regularly, and not just as a persistent symptom, sort of after the fact sort of thing?
Sure, absolutely. I do, and I don't necessarily think. the follow-up question is usually then, do you think all of your patients should get adjusted? And the answer is yes, but not necessarily with a big grand chiropractic adjustment, right? There can be a low force technique that can be just as effective and maybe more appropriate, especially in the acute phases of the injury, that's less stimulating, because let's face it, they're already overstimulated. And so being able to gauge your therapy and figure out how your patient can respond to that is actually a huge part of it, because it's very easy to overstimulate someone. And once you've done that, your therapy day is essentially over.
For sure. And I think that point you make about everyone thinking of that big adjustment that maybe we've all seen sort of online, the big sort of movement. But like you said,
yeah, there's a couple of good ones out there right now.
Yeah, but like you said, if those low force and maybe less stimulating options are available that will do a job for people, maybe that's something I didn't know about. So maybe, that's something for people to consider and sort of educate themselves on. And that's kind of why we're having you on today, so people can kind of get that piece.
Yeah.
Sort of along those lines, something else that I read on your, on your page, and that's really important in your approach to healthcare is education. And why do you think sort of educating your patients is so important?
Because it takes the mystery out of what's happening. The biggest driver of pain is anxiety and fear of not what's going on. So one of the biggest things patients are afraid of by the time they get to me, I'm usually not the first person they've seen, is they're afraid that this is the way it's going to be. Okay, that this is just it. And that's very, very driving for the part of your brain that has to deal with pain. So by demystifying that paradigm, people get better a lot faster if they understand how what I'm doing can help, and why. It's one thing to tell someone to go out and start walking after their concussion to get their heart rate up because it's good for their brain. All right. That doesn't really tell you what it's doing or why they should do it. So they're less likely to comply. And there's, if they don't know why they're doing it and it gives them a headache, well, they're just going to avoid it. And I mean, I've run into it where patients tell you what you want to hear. Did you do your exercises? Absolutely, I did. Great. Let's see them. What do they look like? Yeah, I don't actually remember how to do it. Okay, so you can get some truth out of it that way too. Yeah,
and I think that piece is really important, because concussions are pretty complex, like they're very complex injuries. So I think breaking it down for someone to understand the way even you have today with some of those analogies, I think, like you said, demystifies it. And I think that's somewhat overlooked sometimes. I think it's a pretty vital piece to how people will get better. So I do appreciate that.
It's very easy in this space to get caught up in the technical jargon, and patients don't understand it, and that's not their problem. That's our problem for not being able to make it simple. If you can't explain something to a little kid, do you truly understand how it works? And people that come in with a concussion, they're already having trouble comprehending. I mean, I've got a patient right now that I'm thinking of, we're about 2 months into follow-up care now. She doesn't remember her first couple visits. No idea what we talked about. So, I'll say something about her first visit and she goes, we talked about that. Or, she gave me a personal detail about her life or something. And she goes, I can't believe I told you that. It's like, well, there it was, but they don't remember. So if you're making a complex topic and keeping it complex, they're really not understanding what's happening, and that's not helping them heal. You have to understand what's going on, and are you doing damage? Are you not? Are you truly in danger of what you're doing? And if you can, again, make that less complex, it's a lot easier to heal from.
For sure. And so now, just moving on, you actually mentioned it in the beginning of your last answer, where you said sometimes I'm like the fourth or fifth person that a patient will see. Why do you think that is? Is it that people are simply unaware of the benefits that visiting a chiropractor can have, or there may be certain barriers to accessing chiropractors that people have a tough time navigating? Why do you think that is? That you might be one of the fourth or fifth people that someone's seeing.
Sure. Well, first, concussion's a neurological problem. So the first place most people will try and go is a neurologist. And a lot of times providers, they refer to what they're familiar with. So in
Okay.
the medical world, they're familiar with occupational therapy, they're familiar with physical therapy, neuropsychology, vision therapy, all of these different things that are really under the medical umbrella. And chiropractors, we've long kind of been the pariah of the healthcare world, and we know it, and we don't help ourselves out sometimes either. But we have a lot to offer in this realm of things. And the second piece is, I know it's a little different up for you, but chiropractic coverage really varies by state down here.
Okay.
So in Minnesota, it chiropractic coverage can be very good or it can be very terrible.
Mm-hmm.
And then there's always the reimbursement question. Am I going to get paid for what I'm doing or not? So I am actually an out-of-network provider because I don't get paid for a lot of the rehabilitation that I do. So it doesn't make sense for me to be in that loop. So early on in an injury, most people will try and use their insurance coverage. Well, if I'm not in their insurance network, it's difficult for
Mm-hmm.
them to justify coming in. And then the other piece is just maybe not being aware of what a chiropractor, or in my case, the chiropractic neurologist, has to offer specifically.
Yeah.
And again, that's my fault for not getting that out there. But there's only so much time in a day.
For sure. I think there's like a bit of a sort of, not only stereotype is the right word, but a sort of an idea of what chiropractors or chiropractic neurologists like yourself do that are sometimes false and just labeled with just things that are just simply not true. So I think that sometimes does play a role, and I hope people listening to this podcast and others like this can sort of start to realize that there's a lot of value that can be provided, and then hopefully that kind of sparks some change down the road. That's the
Yeah, I
hope,
hope
at
so too.
least. So we're kind of coming towards the end of our discussion, keeping timing in mind. Just over the holidays, maybe people have a little bit less time to sit down
Yeah.
and listen to a super long episode. So we're going to try and keep this one a little bit shorter than normal. But seeing that it is the holidays, I thought it would be really fitting to sort of try and end on a positive note. So I was wondering if you had any story that really sticks out in your mind about a patient that can really highlight the benefit that a chiropractor or chiropractic neurologist like yourself can have on a patient.
Sure. I've got a patient that does come to mind, and she actually came in about 20 years post injury.
Oh, wow.
And what her lingering symptom was dysautonomia. So she had actually been formally diagnosed with POTS, postural orthostatic tachycardia syndrome. So anytime she would stand up, her heart would start racing, her blood pressure would drop, and she would actually fall over. That was her problem. She had essentially become a shut-in. She couldn't drive. She really didn't do much. She kept really strange hours, just from not being able to sleep. And it took about 3 months, but we got her doing really good. And then I gave her a bunch of home care, and I had a follow-up with her last January. I have her coming in about once a year just to make sure she's not going backwards or something. And at her last visit, her husband looked at me and he goes, "Well, she's crazy now. She jumps up on the countertops and starts cleaning the cabinets," which would have been absolutely crazy before, because she would get dizzy and fall over and hurt herself. She still has POTS syndrome symptoms. She still doesn't drive. She still gets racing heart rate once in a while. So she's not perfect by any means, but she can walk around Costco without a walker. She can go to Target without having to take a break at the front door. So for her, we made really big changes. Not 100%, but we gave her a large portion of her life back.
Yeah.
Doing everything we talked about today. So I that's my favorite one so far. Even though it wasn't an absolute home run, but she's doing really good and she's really happy about it. And I like to tell that story.
That's an awesome story. And I think the part that sticks out about that is maybe there was a fear that was going to be the way her life was for the rest of her life. And I think that's I've heard a lot of people who struggle with post-concussion symptoms that don't seem to go away. That's their fear. So the fact that there's stories like this out there can definitely provide a little positive spark and a little bit of maybe encouragement for those out there who might still be struggling with persistent symptoms of concussion or any other related head or neck injury, even if it's been months or years down the line. So I do appreciate that story, and hopefully
she's a great example of something I tell patients all the time is, you can do nothing and hope that it stays the same, but that's never the case. It almost always gets worse. So
Yeah.
as long as you're doing something and moving forwards, you're making progress, even if it's slow, right? So
That's
don't wait for it to get better on its own.
yeah, that's a great message that hopefully our listeners and of course anybody else that comes into contact with you will take from you, because it's definitely a something that I kind of sort of get from you, is that you're certainly a positive sort of source of support, and it seems clear to me that you're very encouraging sort of practitioner that anybody would be lucky to work with. So that definitely comes
Thank you.
across.
I definitely try to be.
Yeah, for sure. And so that was a fantastic discussion. I'm really, really happy that you were able to come on today, Dr. Hennes. And thanks so much again for taking the time to come on this episode in the middle of the holiday season. I know it's a little bit hectic for everybody, so I do appreciate that. And thank you again just for taking the time to support our chapter from where you are in Minnesota. It really does mean a lot to us, and we really appreciate all your efforts.
Yeah, thanks for having me on.
Awesome. And with that, that sort of brings an end to this month's episode. Thank you so much, everyone, for listening. I hope everyone has a very happy holiday season. And lastly, don't forget to follow us on Instagram at concussion.can.toronto. And I give Dr. Hennes a chance to sort of plug any of his social media or clinic websites if anyone would like to visit them.
Sure. So I used to be very active on Instagram, and with the birth of my son, it just got to be a lot of work, but I still check in quite a bit. So you can find me at invisible_injury_doc on there. Otherwise, feel free to email me too at dr.michaelhennes, Hennes @gmail.com. Otherwise, my clinic is the Neural Connection, and you can always find me there as well.
Awesome. Thank you again, Dr. Hennes, so much for joining us. I hope everyone sort of learned something new today. I know I definitely have, and we will see you in 2022 for a brand new episode of BRAINIAC. Thanks, and take care, everyone.
Thank you.
HeadCheck Health bridges gaps in concussion care through simple, powerful technology. Join organizations like the Canadian Football League, Trek Factory Racing, the Canadian Junior Hockey League, Eastern Washington University, and Volleyball Canada, who rely on HeadCheck Health to improve communication and optimize care. Visit headcheckhealth.com for more. The music at the beginning of this podcast is by Ben Sound, www.bensound.com.